Childbirth and immediate postpartum. Preparing, nourishing, and protecting. The moment of birth is a turning point in your life and your child's life. For months, your body has worked tirelessly to keep your baby safe and growing. The hours before childbirth, the moment of delivery, and the very first moments after birth are crucial for your baby's survival and for your own health. Preparing well, eating and drinking appropriately, and initiating breastfeeding immediately can make all the difference. Nutrition just before and during childbirth. In the hours before giving birth, good nutrition and adequate hydration prevent excessive fatigue, dehydration, and help you recover more easily after birth. Priorities in the Afghan context, based on national guidelines and international recommendations. Hydration. Drink clean water regularly, unsweetened herbal teas, or clear broths. Avoid very sugary or caffeinated drinks, which can lead to energy crashes. A light, nutritious meal at the start of labor. Choose foods that are easy to digest and rich in energy, such as a keshk, porridge made from wheat, yogurt, mild spices, whole wheat bread with a little fresh cheese, or dates, good sources of quick carbohydrates and minerals. Avoid prolonged fasting. Low energy intake before birth increases fatigue, slows labor, and makes postpartum recovery harder. If labor is long, small amounts of natural sweet liquids, diluted juice, vegetable broth, can support muscular effort. Cultural practices requiring total fasting during labor should be adapted. Scientific evidence shows they can increase exhaustion and lengthen delivery time. Early initiation of breastfeeding within 1 hour after birth. Studies from Ghana, Nepal, and India show that starting breastfeeding within 1 hour after birth greatly reduces the risk of newborn death in the first month of life. Colostrum, the first thick, golden milk, acts like a natural vaccine. It protects against infections. It helps the baby adapt to life outside the womb by stabilizing temperature, breathing, and blood sugar. It encourages exclusive breastfeeding for the first 6 months, reducing diarrhea and respiratory illnesses. Breastfeeding and newborn survival. Early, exclusive breastfeeding could prevent millions of deaths in children under 5 worldwide every year. In Afghanistan, where medical resources are limited, this simple act is among the most powerful to save lives. Maternal nutrition after birth. Following childbirth, your body needs to recover and produce enough good quality milk. A varied diet includes grains, legumes, vegetables, fruits, dairy products, and animal proteins when possible. A plenty of fluids. Breastfeeding increases your water needs. Continue supplements, iron, folic acid, vitamin A, calcium, as prescribed by your health provider. Use iodized salt in meals to support your baby's brain development. Good postpartum nutrition directly affects both the quantity and quality of milk you produce. Practical tips for successful early breastfeeding. 1. Skin-to-skin contact right after birth. 2. Correct position, baby's mouth wide open, covering the areola, not just the nipple. 3. No prelactial feeds, avoid giving sweet water, tea, or broth before breastfeeding. 4. Ask for help from a midwife or trained health worker if you feel pain or have doubts about the latch. Key message for Afghan women. Eat light but nutritious meals in the hours before childbirth. Drink regularly during labor to avoid dehydration. Start breastfeeding within 1 hour after birth. Keep eating well and staying hydrated to support recovery and maintain milk quality.